All right, welcome everyone. We're so pleased that you are joining us for tonight's webinar, Physical Therapy, Career Pathways and How to Get There, sponsored by HOSA-Future Health Professionals, elite partner, Northeastern University's Bouvé College of Health Sciences. My name is Nick Ballard, and I'm honored to serve this year as the International President of HOSA-Future Health Professionals. I'm a seventh-year HOSA member, currently in my junior year studying healthcare policy at Cornell University, and I've had the great opportunity to take advantage of HOSA's extensive competitive event programming. So I'm really pleased that tonight's webinar, Exploring Career Pathways to Physical Therapy, really coincides in a lot of ways with our incredible health professions competitive event titled Physical Therapy, as well as so many other physical therapy opportunities that we offer at the upcoming International Leadership Conference. And with that, I'm very excited to be learning more about physical therapy from this team of experts. Just a few housekeeping notes before we get started with tonight's webinar. We'll be planning to share the recording with everyone in a follow-up email. And if you're not already familiar with HOSA's physical therapy competition, we hope that you will take a look at it on the competitive event page at www.hosa.org. If you have any questions during tonight's session, please put them in the chat box. We are delighted to be joined by Melissa Hagerstrom. She's the Director of Undergraduate Enrollment Management for the Bouvé College of Health Sciences at Northeastern University. Also joining us is Jessica Maxwell. She's a clinical professor and the program director of the DPT program in the Department of Physical Therapy, Movement, and Rehabilitation Sciences at Northeastern University. She earned a Bachelor of Arts in Psychology and a Master of Science in Physical Therapy from Boston University, a transitional Doctor of Physical Therapy from Massachusetts General Hospital Institute of Health Professions, and a PhD in Epidemiology from the Boston University School of Public Health. Dr. Maxwell's research interests have been centered around the epidemiology of knee osteoarthritis and joint replacement outcomes, health promotion and wellness content in DPT curricula, and inclusive practices in DPT clinical education. Keegan Dunbar is originally from Vermont. She received her BA in biology from Colby College in 2022, where she played varsity basketball and lacrosse. Keegan did a pre-health certificate at the University of New England, where she continued her athletic career and graduated in 2023. She's currently in her first year of DPT school at Northeastern University. Amaya Gia is a fourth-year Northeastern University student studying health sciences on the pre-physical therapy track. She's worked 6 months full-time as a rehabilitation aide and has taken classes to prepare her to apply for PT school. And finally joining us is Justin Roy, Associate Dean of Enrollment Management at the Bouvé College of Health Sciences. So without further ado, I'll hand it over to Ms. Maxwell.
Good evening, everybody. I want to thank you all for coming. I really appreciate this opportunity to talk about physical therapy, as I think it is, I'm biased, but the best job there is in the world. So I could talk about it all night, and I'm really looking forward to all your questions. But first, we're going to just start with an overview about physical therapy. Next slide. Oh, and then here's our, yep, thank you. Okay, so this is the actual American Physical Therapy Association website's definition of physical therapy. PTs and PT assistants help people maximize their quality of life. They work with people of all ages and abilities in a variety of settings, and they help people rehabilitate from devastating injuries, manage chronic conditions, avoid surgery and prescription drugs, create healthy habits, and more. So while we're known as rehabilitation professionals, along with occupational therapists and speech therapists, we really do more than just rehabilitate somebody after an injury or an illness. So we also optimize function and participation in people that are born with disabilities or that are born with or develop chronic diseases. We also can prevent injuries and illnesses, and we can improve performance in people. So that can include aging adults, or it can include athletes, or really anybody. So the same skills that we use and apply to rehabilitating somebody, which is what you normally think of as physical therapy, we also do that. We can do that for prevention or wellness as well. Next slide. Okay, so I just kind of gave you a big overview of the things that we can do, and how we do it is we use multiple different techniques. So most of the common techniques we use are called manual therapy. So we actually use our hands, and we can stretch people, we can mobilize joints, we can manipulate joints, actually, like you think of like a chiropractor does. That's within the scope of physical therapy too, if you're trained in it. We also prescribe exercise. So instead of just saying, do 3 sets of 10, there's actually ways to prescribe therapeutic exercises and activities in such a manner that they will either increase range of motion, increase strength, decrease pain, depending on what the goal of your intervention is. We also do treat a lot. A lot of what we do is to decrease pain, increase strength and range of motion. We use tools like we can use pulse lavage techniques, which Keegan knows about, to treat wounds. We use ultrasound imaging, like you see when they look at babies in the womb, we can use that to diagnose. So we have a lot of tools starting from our hands, but also going to technology to actually improve the lives of patients. Um, Other things we do that I didn't mention, and that was increasing balance. So we work on balance exercises or neuromuscular treatments to improve balance and activity for people with neuromuscular function. So there's a wide range of our skills that we can apply to help somebody feel better. Next slide. So where we work, it's very broad, and when you come out of school, you're really trained as a generalist PT, but then you can, depending on where you work, you kind of specialize in a certain area. What you're most familiar with is maybe PTs that work in outpatient settings. So what that means is when a patient, either presents to a facility and they do not stay overnight. So they go for an appointment for a half hour or 45 minutes, and then they go back home. Maybe they do that 2 or 3 days a week. So there's different types of outpatient settings. So there's, some clinics that are ambulatory care settings run by hospitals. There are physical therapists that own their own private practices. So usually, like I said, there, because you're not sleeping there, you're not staying over, that's for usually people being seen for rehabilitation. So after an injury or an illness, or if they have chronic diseases or aging, and we're trying to get them back to what we call their prior level of function. Another large setting that PTs work in is in an inpatient setting, and that is when people stay over in the facility. So that could be an acute care hospital when your condition or your illness or your injury is very new. Maybe you just had surgery on your knee, or maybe you had surgery, cardiac surgery, and the physical therapist coming in that day or for a few days following to get you ready to go home, and then they'll follow you in an outpatient setting after that. Sometimes people need a little bit longer stay, and they move from an acute care hospital into what we call an acute rehabilitation facility. And those are for people that need up to 3 hours a day of rehabilitation intervention. So it's usually a combination of physical therapists, occupational therapists, and sometimes speech. So you can actually be spending an hour and a half a day with each of your patients, working on rehabilitating them maybe for 3 to 6 weeks. It's getting that extra step to get home. This could be for somebody maybe that lives in a home and their bedroom is on the second floor, or they had such an illness or an injury that it's going to take them a little bit longer to get back to where they're going to be safe on their own at home. There's also the in-between, the short-term rehabilitation, rehab facilities, long-term acute care hospitals, so kind of the whole spectrum of inpatient facilities. Of course, for both outpatient and inpatient, then we can also specialize. So there's, hospitals specifically for pediatrics, right? Working with kids, or there's hospitals specific to orthopedic injuries. So it really can vary depending on the patient population or the condition that's being treated. And then aside from your traditional health settings, PTs also work in schools. We work in nonprofit facilities, and we also do home care. So that's kind of an in-between too, that maybe people can't, they're not sick enough that they need to be in the hospital, but they don't have the means or the physical ability to get to an outpatient center. So we'll actually treat them in their home. Next slide. Okay, so I talked about this a little bit. What we try to gear our treatment to is what the patient's goals are. Really, we want to get them, we might not say, you have to go back to running a marathon. Maybe they have no desire to do that. So we really collaborate with our patients. So a big part of what we do is we listen. We listen to our patients and clients. We ask them where they want to get back to. We consider the physiology of their illness or condition, and then we make goal setting together to figure out what it's going to be that we're going to work towards in our sessions. So these are kind of the micro goals of increasing range of motion, strength, and balance. But the bigger picture is what they want to be able to do in their life. So we use the techniques I talked about earlier to do those three things. And then the idea of that is to increase or optimize their function. So next, we want to get you to be able to do a sit to stand on your own, get out of the bed by yourself. Maybe we want to walk 250 feet. We want you to be able to go up a flight of stairs with one crutch and a railing. So we try to be really specific about what our goals are and what our treatment. And then the next step from that, depending on the patient or client, is to increase or optimize their participation. And what participation is your involvement in your home and community activities. So this is different for everyone. For some people, they want to get back to work. Other people want to get back to school. Somebody might want to go back to their book club that's at the library that they have to walk up 17 steps to get into that library. So we really taking the step further from just being able to like climb the steps to your bedroom to actually be able to climb those steps in the library, get in and off the bus, walk 25 feet, 250 feet to those stairs, sit through a book club session for 2 hours and then repeat on the way home. That's a very different set of circumstances and takes more therapy to get you to that point. So it really is a spectrum. This kind of highlights what I love about PT is that we get to spend a lot of time with our patients. So really, you might get to you see them and you might get to see them for over 3-4 months, depending on the setting you work in. If you work in a hospital, you might be working with people for 3-4 days if you're in an acute care hospital, but if you're in an outpatient setting, it could be up to 3-4 months. So it's really nice to be able to see that progress over time. Next slide. Okay, so if you've noticed, there is a D in front of our initials. So a DPT is a Doctor of Physical Therapy. This is a clinical or professional doctorate degree. So it's not a research doctoral degree like a PhD, for example. There isn't like a dissertation you do at the end, although we do have a capstone project at Northeastern's program. There's a couple different pathways you can use to earn your DPT. So it's a graduate degree. You can go to an undergraduate institution and get a bachelor's degree. And if you do that route, you can major in anything you want. You can major in art, you can major in music, whatever you need to, and that's totally okay. Whatever you love and what you want to study is great. Just in addition, you need to take the prerequisites that are required by the programs that you apply to. And I'm sure there'll be some questions on that. I'm happy to answer them. Or you can do a different pathway. There are schools out there that have a kind of accelerated pathway where you start in the DPT program as a freshman in your undergrad, you do a few years as an undergrad, and then you start the DPT program, or the professional part, we call it, before you actually receive your bachelor's. You receive your bachelor's, and then you go on to complete and finish the DPT. And again, if you have questions about that, we can certainly talk about that in a few minutes. Next slide. Okay, so this is my contact info. I'm happy to speak with any of you at any time. So just send me an email. We can set up a Teams meeting, or we can do a phone call. I'm happy to help you and talk about physical therapy and see if it's the right field for you at any time. So thank you.
All right, these are my slides. So my name's Keegan. I'm a first year physical therapy student at Northeastern. I just wanted to kind of start and give the background. Dr. Maxwell just talked about it, but I did not go into school thinking I was going to be a PT. I went into my undergraduate degree at Colby College and I majored in biology with a concentration in neuroscience. And at that time, I thought I wanted to become a medical doctor or maybe a physician assistant, and those were really the things that I thought I was interested in. I did some shadowing, and I shadowed orthopedic surgeons, I shadowed OBGYNs, I shadowed in a lot of different facilities, and I just realized that I did not like being in the hospital that much, and I also really noticed how as a physician, you're really only able to spend like 10-15 minutes with each patient. And I really wanted more of that time with each individual patient and really be able to get a sense of who they are and treat them as a whole person rather than just one disease or one thing that I was treating. So that being said, I graduated from Colby but did not have some of the prerequisites that I needed in order to get into PT school. So I went to the University of New England and I did a pre-health certificate. At that time, I was able to take anatomy, physiology, exercise science, and do all the things that I needed to do to then apply to Northeastern. While I was at the University of New England, I really found that from my background in collegiate athletics, I really enjoyed sports physical therapy and working with athletes and people that were rehabbing from injury and really focusing on the aspect of human performance that's within PT. And yeah, now I'm here at Northeastern. You can go to the next slide. Perfect. So I did a gap year after my pre-health certificate at the University of New England. And during that time, I did a bunch of PT shadowing hours. A lot of the places you might apply to require some sort of patient shadowing hours, whether that's as an aide or whether that's shadowing. I chose shadowing, and it really opened my eyes to all the different ways that you can be a PT. So orthopedics, pediatrics, and acute rehab. Dr. Maxwell talked about that a lot already. But what I found really interesting was you use your brain and your skills so differently in each of these settings. And I found that to be really fascinating and exciting about physical therapy. I also was a patient care coordinator at a physical therapy clinic during my gap year. So I got to really know how a PT clinic works and see kind of the behind the scenes aspect of that. I helped do some youth sports performance coaching, and I got my performance enhancement certification through the National Academy of Sports Medicine. But another thing we could totally dive into as well is you could also get something called your CSCS, which is like a strength and conditioning certification. And then I also waitressed, which I throw in there to say that there's so many different things that you can do that will look good on a resume to a PT program. And I actually just went through some interviewing for Northeastern's co-ops, and all of the interviews I had, people pointed out my waitressing job, which was interesting to me because it's the one that has the least clinical patient experience, but is a really good way to work with patients and with people, not patients, but with people, and get your people skills and your ability to problem solve and work quickly. So I threw that in there just because I think it's important. And then those are just all the logos of the places that I was able to shadow or work during my gap year. You can go to the next slide. This is just an outline of what my day currently, like this was like my week this week as a PT student, and I've got some pictures from anatomy lab in my first summer here at PT school, and then those are some of my friends from school. I've found a really great community, and we go running together and do lots of active things together, which has been really fun. But this is my typical schedule. Right now, I'm in cardiopulmonary, so we're doing listening to the heart, listening to the lungs, things like that. I have PT administration, which talks about insurance, all of those things, pathology, talking about a lot of the different things that we might see in a clinic, and then a lab for cardiopulm. So that's when, again, using the stethoscope, checking patients out, coming up with a plan for how you're going to treat them. So that's a bit of a longer day. And then Tuesdays, I have a health education and wellness lecture and a professional development lecture. Wednesdays, PT administration again. Thursdays, I don't have any class. I just watch lectures online. And then when we go into class, we talk about all the things we learned in the lecture and start to use that material. And then on Fridays, I have research and statistics, pharmacology, and health education and wellness again. This is just what I'm taking this semester, but in previous semesters, I've taken anatomy, I've taken integumentary, which is focusing on the skin and wounds. And then in the future, I'll be taking neuro, and then I'll also be taking musculoskeletal, which will focus more on the PT stuff. And then, yeah, you can go to the next slide. This is just my contact information. Feel free to send me an email if you have any questions. I definitely had a roundabout way to PT school, but I'm always happy to help. I found that I was pretty successful in the application process, so I'm happy to give any advice as well.
Maya, I'll hand it to you. Okay. Hi, my name is Amaya, and I'm a undergraduate student at Northeastern University, and I'm majoring in health science, and then I'm also minoring in human movement sciences. So I'll start with talking about why I chose to be a pre-PT student. So essentially, in high school, I've always been interested in healthcare, specifically and specifically physical therapy because of the rehabilitation side of healthcare, which I really appreciate. So in high school, I did a few outpatient shadowing opportunities at a few clinics. That's not a requirement to pursue any sort of pre-PT track in college. It's just something I was interested in, so I pursued that. And so at Northeastern, I decided to be a health science major because health science here covers a lot of hardcore science classes plus a public health overview. So I thought it would be a great balance and a way for me to understand healthcare more broadly and then add on the pre-physical therapy track sort of classes. So in terms of classes for my pre-physical therapy uh, requirements, I've done classes such as exercise physiology, anatomy and physiology, developmental psychology, and then adding on the pre-physical therapy track here, I was able to do kinesiology and human motor control. So a lot of these classes have prepared me and definitely strengthened my interest in pursuing physical therapy and going into a doctor of physical therapy program. A few other things I did at Northeastern was I was involved in the physical therapy club here. So that way I've been able to make a lot of pre-physical therapy friends, and attended a few webinars and lectures by other professors and professionals in this field to listen to their experiences. And then also I was able to work for 6 months full time while I was in my undergraduate education at New England Baptist Hospital, where I was a rehabilitation aide in an inpatient setting. So it was a great way for me to get exposure to inpatient physical therapy, in addition to the outpatient exposure I had gotten in high school. So I think I've been pretty successful in gaining these experiences, and they've been very good opportunities through classes and work opportunities. And I've been also able to stay per diem at the hospital uh, throughout these past 2 years from when I started the 6 month opportunity. So yeah, those are pretty much my experiences in undergrad for PT school when the time comes for me to start PT school.
Fantastic. Well, thank you all so much for that overview and hearing about your backgrounds and some great questions coming in the chat. So I'm going to moderate that. I know Dr. Maxwell and Keegan put in their contact information, but I'm just dropping these links in the chat right now. These are ways to get more information about Northeastern. If you're a current college student and you're looking to apply into DPT programs, that first link's a great option for you to request more information about Northeastern's DPT program. And if you're a high school student, you're looking to get some more information about Northeastern and Bouvé College of Health Sciences, that bottom link's a great way to stay in touch with us and learn a little bit more about that. So I'm going to kind of start from the bottom here. So there's a great question about, do you need experience to go into physical therapy? Maya, I'm going to have you start with that first because you're looking to apply into DPT school and you have been able to gain some great experience. So what did you do in high school and what are you doing in college that you think is really preparing you for the next step? I know you kind of talked about that a little bit already.
Honestly, just the classes I've been interested in, I've been able to pursue here. Like I said, I added on the minor in human movement sciences because health science just covered more like biology, physics, chemistry sort of classes. Just because of my own interest, and I had space in my schedule to put in other classes that are more physical therapy focused. That's why I integrated that into my schedule to learn more about that before I start PT school. Like we said, it's not a requirement or anything like that to go into PT school. It's just some of the things that Northeastern has on their list of pre-physical therapy requirements. It's a great idea to take those classes to prepare you for that school. And depending on whatever undergraduate curriculum you're in, you can follow the pre-PT requirements, and usually all the schools do a good job of having pretty much the same sort of requirements like anatomy, physiology, and those type of classes. And then in terms of work experience, I think you need about 40 shadowing hours to apply to PT school. So I covered that in my 6 months of work, but any sort of inpatient and outpatient opportunity, even if it's for a week, would be a great amount of experience to gain before attending PT school.
That's great. Dr. Maxwell, there's a couple questions about the application process into DPT programs. One student was wondering if kinesiology,
Kinesiology.
all the PT words are so hard to say. Is that required to apply to PT school? And then also, is there an exam required,
Yep.
like the MCAT for medical school?
Yeah, so every DPT program may have different prerequisite courses. There is not a set specific courses that you have to take. It's up to the individual school what they want their students to come in with. So at Northeastern, we do not require a kinesiology course when you apply, although some programs definitely do. In addition, some schools require the GRE, graduate
Record exam. Yeah,
record. Is it still called record?
I think so. Yeah.
The GRE, Northeastern does not require the GRE for admission.
And there's a question in here about how important is your GPA to being accepted into PT school?
It's important. Most schools, I would say probably almost all schools require at least a 3.0 cumulative GPA, and then they generally also look at your GPA on the prerequisite courses. The prerequisite courses are basically the sciences and psychology for most programs. So they want to see that you did well in the sciences because that's what you're going to be doing a lot of in the DPT program. Yeah. Go
I was going
ahead.
to say, do you see a lot of students doing a post-bac program like Keegan did? So if maybe your grades aren't exactly where you'd like them to be as an undergraduate student, do the post-bac programs factor into that?
Oh, actually, it's fairly rare. I would say, if it's more for somebody who, not necessarily about their grades, but maybe they majored in music or art and they couldn't fit in the prerequisites that the program. So then they can take them at 6 different schools, or they could do a program like Keegan did, get them all done and apply. So it really depends on just your personal route.
That's great. Keegan, there was a question here about pharmacology, and why do you take that?
I'm in pharmacology right now because it's required by the PT program. So all my classes, like none of them were just me deciding I wanted to take them. They're all required. There are some concentrations in our program that we're able to do. So I'm really interested in our sports concentration, which will allow me to take some elective classes. But in terms of why I have to take pharmacology, as a PT, you need to be able to read a medical chart and be able to decide like, make sure, okay, there's certain side effects that might impact my treatment of the patient based on their medication. So I would say surprisingly, as I started PT school, I was like, oh, there's no way it's going to be as hard as like my friends that are in med school. Like you get a really good education and it's very well rounded. And I think people underestimate how much PTs need to know.
Can I just tag on to that back
Yeah.
to the question a little bit? So DPT programs are accredited by an institution called CAPD. It's a commission of PT education programs. They have a strict kind of list of all the content that PT schools have to require. So the curriculums may look a little bit different when you start to look into them. So you might not see a course called pharmacology, but they will have pharmacology content in that course. Maybe it's embedded into a pathology course or something. So bottom line is somewhere, somehow, all DPT programs will cover the same material because we have to. But like Keegan said, when you're looking for a school, you want to consider, are there additional, do they allow for a little bit of electives on top of that core content? Do they have concentrations where if you're super interested in pediatrics or sports, you have that opportunity as well.
That's great. There were some questions in here about the length of DPT programs. I know they vary as well. Do you want to talk a little bit about that?
Yeah, so like I said, we have to get everything in that we're required to teach. The minimum is 96 weeks, and then the maximum can be whatever. But basically, most of them are around 3 years, 2.5 to 3 years. There are some that are a little bit shorter and some that are a little bit longer, but that's the rough time. And then once you finish it, you get the degree, you get verified for licensure, and you can sit for a national physical therapy exam. So you have to be licensed to actually practice. The degree alone is not sufficient to practice.
Okay, that's great. And then just to ask in there, there was a question about prepping into that. So you do need to get a bachelor's degree first if you are not enrolling into one of those programs that Dr. Maxwell was talking about that kind of combines the undergraduate and the graduate portion together. So the typical path would probably be a 4-year bachelor's degree and then applying onto a DPT program. So Keegan did take a break between, she went to school and to classes between those two. Amaya is going straight into a DPT program right afterwards. So there's not one correct pathway, and there's a lot of different ways that you could do that. But most students are doing the bachelor's and then the graduate portion there. Amaya, there's a question in here about logging hours as an undergraduate for preparing. Was there like a specific way you had to do that? Was there like a...
So I want to point out that not all schools require observation hours. Northeastern does require 40 hours, but it's not required by any school that you have to do them. It's a super great idea to do that though. And that so you know kind of what you're getting into, what PT is. And like Amaya said, like looking at different settings, maybe you do 20 hours in outpatient, 20 hours in inpatient. At Northeastern, like I said, we require it, but we don't require verification of it. So, we don't have a strict logging form or anything, but some schools certainly do and might.
Yeah.
That answer that question.
Did you want to add anything, Amaya?
No, I think that was good. Yeah, there's no, I guess, like formal logging in of hours or anything like that. It's all on my resume anyways, so it's pretty much like already there of what I did.
That's great. There's a question in here about what a travel physical therapist, what does that look like?
Yeah, so that's actually cool. I mean, that's a setting that you can work in. And there are companies or organizations that have travel nurses, travel PTs, and so you can work for them. And they usually do like 13-week assignments where they would place you in an area that is short on physical therapists. Sometimes it's in an outpatient setting, sometimes it's in an inpatient setting. So it's cool, like if you want to be able to do different things. I've known people who have done it and they've loved it. Sometimes we like to say don't do it right away when you first graduate because you want to make sure you're in a place where there's lots of therapists around and you can learn from them. Because if you do traveling, like I said, it's usually an under-resourced area where there's no PTs. So you could be in a situation where you're, alone in the clinic. But that being said, I know that there's some companies out there that really try to nurture new grads too in that setting too. But it is a super fun and exciting option that you can do for work.
That's great. And I'm hoping to hear everyone's take on this because everyone's in a different place. But there's a couple questions in here about advice for high school students, both in how to prepare yourself to be a competitive candidate for DPT programs, if you're looking into, the direct entry DPT, or what classes you could be taking in high school to really prepare yourself for this pathway. For example, there's a question about if nutrition is a good class to take. But any advice you have for high school students who are thinking about this right now? Amaya, do you want to go first?
Yeah, I think in high school, honestly, I just was very involved in a few service clubs and like I said, I did some of the outpatient observation hours, but it's not a requirement. I was just very interested in it. And my high school, I did the 3 basic sciences, biology, chemistry, and physics, but then my high school also offered anatomy, physiology, and kinesiology. So I took those classes because I was really interested in that. I think there was a question in the chat about outpatient opportunities.
Yep.
And honestly, I just knew my parents, friends, someone in our family had to go to physical therapy. And so, because they said, oh, my physical therapist was great and all of that, I just reached out to the person and I was like, hey, can I just come to your clinic and observe for a week or something like that? And I didn't know what to expect from that, but honestly, just for my first time experience, just going there and sitting there and watching how a physical therapist interacts with their patient, seeing what the behind the scenes work was, so administrative work, just seeing what the day in the life of a physical therapist was really, really beneficial. So I think for anyone wanting to find out a little bit more about what that is in high school, it definitely doesn't hurt to reach out to someone in your area, maybe if you know a physical therapy clinic. I think outpatient is definitely easier to find those opportunities than inpatient sometimes because inpatient, I guess, requires more training and yeah, just more training and logistics. So I would suggest if you're interested in anything like that, just reach out to someone at an outpatient clinic, ask the front desk person, or try to contact someone by email.
That's great. Keegan, do you want to go next?
I would just echo a lot of that. I know we've mentioned that my path wasn't as straight through, and so I really took my time to make sure I was making the right decision for myself, in what I wanted. But I did see a question about like how would you go about shadowing, and Maya definitely like touched on this, but I just literally made a list of places in my area that I had no connection to and called them and asked if they would take me as a student to shadow. And I ended up with over 100 shadowing hours just from doing that.
As a high school student?
That was when I was post grad, but you can
Oh,
definitely do it as a high school student. I also had some hours from high school, but most of them were after I graduated from my bachelor degree.
that's great. Dr. Maxwell, if you have anything else you add in there.
No, I think, enjoying science when you're in high school is probably, because you're going to have to take it again for all your prerequisites in undergrad, and then you're going to have to do it again in DP school. So, it's more of that exploration, like, do I like this kind of content? And then, if you do have an opportunity to be in a club or do some shadowing or something, just to see if this really feels like something you want to do, because it is a big commitment.
That's great. There's some really interesting questions here about vision therapists. Is that something a physical therapist does? And do you follow the same route?
So PTs do work with patients who have visual impairments. For example, we do send students on their cooperative experiences to Perkins School for the Blind in Boston. But there is a kind of a branch of occupational therapy for low vision therapy. So it falls kind of under that specifically. But we do obviously treat blind patients as we would anybody else or people with visual impairment.
Do you work with orthotic patients?
Yes. So if you buy orthotic, that's a large term. So not only the ones that go in your sneaker, foot orthotics, but also we call orthotics like any kind of braces. So even like above the knee hinge braces, things like that. Absolutely. So we can even work with the prosthetists and orthotists that make those devices to make sure, we're getting the best option for the patient to increase their mobility. And then, yes, continue on with the rehabilitation for them.
And we have some, again, great questions coming in. And there's a lot of students who are very forward thinking, which I really appreciate. So there's a couple questions in here about whether PT school is expensive. And I think the cost of PT school is really going to vary depending on where you're looking. So it's going to be very, very variable. That's a tough question to answer. But there's a great question in here too about whether the career is worth it with like the amount of debt you would take on, with the types of salaries you'll be getting. And then another question in here about with the future of AI and AI advancement, what does that look like for physical therapy, which I think is a really interesting question, something we talk a lot about in Bouvé, because the intersection of healthcare and technology is obviously enormous and something we're really thinking about. So Dr. Maxwell, I was just curious if you could chime in a little bit about what you're thinking about for the future, and anyone who is a little concerned. I know there's a lot of students when you're thinking about taking on student debt for a career, it can be really anxiety provoking, and what your thoughts are on that.
Sure. And I'd love Amaya and Keegan to hop in on that part too, and what they're thinking and what they're hearing people, how it's going out there. But in terms of the AI is not going to be able to mobilize or move a joint for me. I still need to apply my manual skills myself, but it is going to be able to help me probably make better clinical decisions and maybe write my notes a little bit faster. But I don't think it's going to erase the need for physical therapists, because so much of what we do is with our hands, with our guiding, with our brain, deciding, on certain treatments and making split-second decisions based on the patient's response and adapting. You can't like run to a computer and say, this isn't working, this balance exercise, what do I do? Like, it all is in the head, in the moment. And like I said, a lot of it is physically with our own hands. So I think it's going to assist us, but it will certainly not replace us. Like Melissa said, costs vary for programs, but salaries are also very good. Everybody's situation is different. But I do obviously think it's worth it. I want to say now salaries are in the 80s, right? For starting salaries or high 70s, low 80s, and then on up, depending on what setting and what part of the country. It varies, obviously, in what part of the country you live into. So yeah, I'll turn it over to Keegan and Amaya too on that.
I just went through the decision-making process of which school to go to and dealing with all the student loans and stuff. I had a couple options for schools, and one of them would have been in-state for me, which would have been a little bit less expensive. So that was certainly an option. However, Northeastern had so much to offer for me in making sure I was confident in the beginnings of my career, and really had a lot of hands-on experience that I wanted. So I made the choice of picking a school that I knew would really help, like, be a stepping stone for my career rather than picking the cheapest option. And it's always just like lifestyle and the things you choose to do outside of school that can help you save money. So I think it's kind of about deciding how much that matters to you, I guess.
And then I'll talk about just the AI aspect, pretty much what was said. But I think at the end of the day, any sort of healthcare field, I just feel like it's hard to replace your actual doctor with a robot telling you what to do, because I think humans just need the human to human interaction and connection. So AI would definitely assist in research and analysis and just like heavier sort of understanding that maybe we don't have yet. But I don't think that AI can fully replace your doctor, because we do need the human to human connection at the end of the day.
Definitely. Really great question about your health, your own personal health as a physical therapist. Has your health deteriorated at all? Is it a viable career as you advance in your own age? How does that work?
29 years and going strong. I worked all day yesterday at Northeastern, and I went and I saw 3 patients last night. I was cracking backs. I was showing them exercises on the ball. I mean, you want to keep yourself healthy too, obviously, to do your job in any field, but certainly, absolutely, you can do this. I know many PTs. In fact, one of the PTs at my clinic, 40 plus years experience, and she does 10-hour days, and she's mobilizing feet and instructing people in exercises. So
I
yeah,
was gonna say you might be in a better position to keep your body healthy
I
and strong
know,
than yeah.
know
You
what to do. I can't say I've certainly had pains and injuries in my life, but never related to my job. So, but
That's
that's a great
fantastic.
question.
Yeah, it's a great question. There was a question earlier about studying abroad as a physical therapist student. I think we touched a little bit on that about the travel PT. But do you want to talk about global experiences or global opportunities in DPT
Yeah,
school?
because I do have kind of an opinion on this. So I thought that was a really great question. In undergrad, you can certainly study abroad, and at Northeastern, we have co-ops, and you can do an international co-op. When you're in a DPT program, every DPT program has a minimum of 30 weeks of clinical education. Usually that's split across 3 different internships. There are schools that will allow you to do some of your clinical time in a different country. And actually, prior to COVID, we sent students on clinicals to other countries. I just want to say, though, you're earning a DPT degree in the United States. That's what's required. And, our students would go to these other countries and love that experience, but they didn't get that level of practice experience in those other countries. So you had to make a strong decision before you decide to do that. If you only have 30, 36 weeks of clinical experience, supervised time, you might not want to choose that, but go for it when you're an undergrad. Do a co-op or do a study abroad, or do, at Northeastern, we have Dialogues of Civilization where you can go for 5 weeks to another country and immerse yourself in learning about their healthcare system. But think about it carefully if you want to do it for your actual clinical experiences.
That's fantastic advice. There's some questions in here about the average workday as a physical therapist, and how you manage a work-life balance, the difference between being a physical therapist and a chiropractor. So if you can talk a little bit about those practicalities.
Sure. All right, I'll handle that last one first. So, chiropractors can't do PT. That's a kind of a legal rule. So, they're kind of limited to their joint mobilization realm. Whereas we can do joint mobilization, we also can prescribe exercise, we can also do balance exercises, all those things. So I think the scope of our practice is larger. Then I'm going to switch to average workday. It depends. One of the awesome things about being a PT is because there's a million settings you can work in that we talked about. And if you want to be part-time because you are a waitress, every night, that's fine. You can be part-time, or you have a family or whatever, or you can work, you own your own practice and you do 60 hours a week. So it just depends what you want to do. If you work in a hospital, typically it's, 5 8-hour days or 4 10-hour days. If you work outpatient, it can vary. Some people go in, they do 2 hours. Like last night, I saw 3 patients. Next week, I only have 1. So it's very flexible in that way.
That's great. Keegan, do you want to talk a little bit about life as a PT student and how you're balancing that, and how, if you find it very competitive or stressful, and how that is for you as a student?
Yeah, absolutely. I mean, I did mention like it's a lot. It's hard, but it should be hard. You're treating patients at the end of this, so it should be hard. However, like I think time management skills are really important, and I'm still able to do things with my friends and go for runs. Like I had the picture of my friends and I going for a run, and I just really prioritize like taking care of myself and doing the things I want to do and not sacrificing on those things, but still doing well in school and taking the time to study. And then in terms of if it's competitive, I think that might come down to this like if it's competitive between classmates, I think that comes down to the school that you're at. I don't find that here we're competitive. I think we're very supportive. Like my friends and I will send each other tutoring notes, and like we'll practice. Like on the weekends, we'll be like, hey, we have a practical coming up. Like, do you want to meet me on campus? And we'll practice for an hour. And so we're really all invested in making sure we all graduate and we all get our DPT at the end of the day. So at Northeastern, I don't think that's the case, but again, I think it really depends on probably what school you go to.
That's great. Amaya, there was some questions too about balancing everything as an undergraduate. There was a student who was specifically asking about being a student athlete. And I know that while you're not in DPT school right now, as an undergraduate, you need to be taking a lot of classes to make yourself a competitive candidate and having a really strong GPA and all the other experiences you talked about too. Do you want to talk a little bit about how you manage that and have a balance and are able to keep all those balls in the air?
Yeah, so along with my classes, the work experience I was talking about, I've been able to schedule in per diem shifts every week. And then I've also been heavily involved in the South Asian organization on campus. And then I prioritize my health, go to the gym to stay fit. But I'm able to do all of these things because I just stay very organized on my Google Calendar, and I plan all my homework like all in advance. I can get it done in time. I think as I started college, I made sure to find like a good balance between classes, studying, going to the library, but then also hanging out with my friends and family by using different organization software. So, like I said, Google Calendar, and then an app called myhomework.com, where I've been able to just stay very, very organized and balanced. And I hope that I'm able to translate all of that when I go to PT school, because it will be harder for sure. But having all these activities and work experience in college has kept me pretty busy, so I feel like I'm been pretty good with managing everything.
That's great. Dr. Maxwell, there's some questions in here about we've been talking about DPT programs in the United States. Northeastern, our program is a US-based DPT program. There's questions in here about what education is required in different countries, if you know, and then also the scope of a physical therapist. Does that vary country to country?
I don't know. So I don't know. I don't believe there's any other countries that are at the clinical doctorate level. I saw a question about Canada. The
Yeah.
level of practice in Canada is very high. It would probably be very similar. And I know that, there's on either side some US PTs practice in Canada and vice versa. And they certainly hire American PTs in Canada. Aside from that, I don't know what is required in other countries. And I also don't know their scope of practice. Are they allowed to manipulate joints, for example? I mean, even in the US, there's a couple states where you can't manipulate joints. So
Mm.
scope of practice can differ by state, and then I'm sure it does by country. But if you come to school here, you'll be getting a DPT.
So if you go to school in the United States and get a DPT and then you graduate, is there an exam you need to take to become licensed? Are you eligible to practice in any state? Do you have to take an exam per state? How does that work?
It's a national physical therapy exam, the NPTE. So you take it and this passing score is the same, but you have to submit your materials for licensure showing that you finished school, you did all your clinicals, you submit all that to a particular state that you want to practice in, and you get licensed in that particular state. So the exam you take is the same. But you're getting a license for a particular state. Some states have additional other things where you have to actually take like a test. They call it a jurisprudence exam, where it's basically like you need to know what you can do in that state. Because like I said, in Washington State, you can't manipulate, so they'll say, what's your scope of practice? But the PT practice exam is the same. There's also what's called the PT compact. So if you're licensed in certain states, you can practice in other states that are involved in that compact. But not all 50 states are part of that compact yet. So if you want to move and practice in a state that isn't part of it, you need to submit all your stuff again, your score on the exam and all that, to get a license in that state. But you only have to take the exam once.
And can you share what manipulate a joint means?
Yeah, crack a back. So we do a lot of joint mobilization techniques where we're manually using our hands to make joints move better if they're stuck or stiff. And when you do that at a very high velocity where you hear like a crack, that's called a manipulation.
That's great. Um, you might not know the answer to this, but there's a question in about projected job growth and demand. I would imagine it's high. Our
Yeah.
population is aging.
It's 14% between now
14%.
and 2030.
Wow. Yeah.
And it is because the population's aging for sure. So it differs, but it pretty much in every state, it's going up. The need is.
That's great. Amaya, I don't know if you remember what AP classes you took in high school and how they prepared you for college. There's been a couple questions of that in here. I know everyone's trying to do course selection, I can tell, for next year.
Yeah, I just took AP biology and AP psychology, and then my high school changed it to AT, which I don't know if yeah, and then so you could take like an AT kinesiology course, which was similar to AP, but officially I took bio and psych, and that was it. But again, not a requirement for college. That's just if you're interested in taking a higher level biology or psychology or whatever, that's up to you based on your interest.
Keegan, do you remember if you took anything?
I also took AP Bio. I would say that high school is obviously important, but I think undergrad is probably more important for your DPT and getting like into that PT world.
That's great. We are getting close to 8 o'clock, so I just want to be mindful of the time. Again, I'm going to put my contact information in here too, and I can always direct any questions to the appropriate location. But there's just been so many amazing questions in here too. So thank you all so much for your attention and asking all these great questions. So that's my contact information, and I can get it out to the appropriate areas as needed. In our remaining few minutes that we have left, we've had such a wide range of questions from students. You can tell people have been thinking about physical therapy and have great questions about the career. What advice would you have for everyone watching this webinar on next steps, what they should be thinking about, what they should be considering as they're thinking about a career in physical therapy? I don't know who wants to go. Am I
Yeah, I can start. So from the undergraduate perspective, definitely take your time in high school to explore, other career paths also, or if you still think you're interested in healthcare, explore the other healthcare fields. Physical therapy is a great one. Specifically, I just really love the rehabilitation side of things and not sort of like the surgery or medication intervene sort of healthcare field. So that's why I really like this field. But take your time in high school to explore the things you like. And when you come to college, you don't have to, again, have a fixed decision what you want to do. But while you're in college and you think that this is the route for you, definitely see if you can get some of those experiences in more sciencey classes. See what your school has to offer for free physical therapy. And then if you it doesn't hurt to always reach out to any medical professionals to get some sort of shadowing experience in the physical therapy field.
That's great. Keegan, do you want to go next?
I would just echo everything Amaya said, and she mentioned it earlier, but time management, the earlier you can get your time management down, the easier undergrad and PT school will be. But yeah, just take your time. I definitely took my time, and I'm so happy that I did because I feel like I made a very confident decision in the field that I wanted to pursue.
That's fantastic. Dr. Maxwell.
Same thing. I mean, just explore, have fun. You'll be doing, like Keegan said, you don't have a choice what classes you take and what you're studying. So now's your time to really have fun and decide what you might want to major in PT, in undergrad, and then look at the prerequisites that are required to go on in that. Like Keegan said, get your time management skills down. But really, it's just time for exploration and thought about what you want to do.
That's great. I put in the chat again the information for if you're a current college student and you want to get more information about Northeastern CPT program, or if you're a high school student looking at colleges, we'd love to stay in touch with you. Justin and I will be in Nashville in June, so we hope we get a chance to meet all of you in person. Come introduce yourself, say hi. We love getting to meet you all and get to interact. So thank you all again so much and have a fantastic evening.
Thank you all for coming.